Good afternoon. Welcome to our COVID-19 update in Eau Claire County. It's an opportunity to share with you what's happening related to COVID-19 in our community, to answer some questions, and to make sure that you have the information that you need and the resources you need as we face a difficult time in our community. It is Friday, May 8th. Hard to believe that we are at Friday. I hope everybody is ready for a good weekend. Today is National Provider Day. It's a day that childcare providers, teachers, educators of young children are celebrated. Those childcare providers, those people play a really critical role in our community and provide an important service to our families. They always have done that. They are resources for us in really critical times like this so that people can go to work. They can have the time and ability to do those things that they need to do and be comforted that their children are taken care of. My children and I had a wonderful network of providers supporting us as they were young, and all of them are really appreciated. So again, thank you for joining us for updates. Our state update. In Wisconsin, we now have 97,265 tests, negative tests for COVID-19, an increase today of 4,230 negative tests. There are now 9,590 confirmed cases by testing of COVID-19 in the state, an increase of 375. Of those positive cases, 1,767 of them did have a hospitalization, about 18% of the positives. And we now have 384 Wisconsinites that have died of COVID-19, an increase of 10. Again, a hard number in a short amount of time with the disease. The statewide positivity rate, again, the percent of those tests that have been done that are positive, is around 9%. That is fairly steady. We were at 10% for quite some time. We've now, over the last 30 days, been holding around 9%. Compared to locally, where previously we were at just under 2% positivity, and now we are closer to 5% positivity. Again, that's a way to check to see, are we testing enough? And of the people we're testing, what does a disease course look like in our community? The state is now, as you see, doing more testing. The numbers are increasing, and we're at about 3,000 to 4,000 tests per day in the state. The capacity, again, is 14,000 tests a day. So we have room to improve in getting people tested, and it's certainly a very strong goal in the state to do that. In Eau Claire, we now have confirmed 53 confirmed cases of COVID-19 from testing, an increase of 4 since Thursday. Our testing numbers are at 2,637 people tested, an increase of 90, with 2,508 negative tests and 76 yet pending. As we indicated on Wednesday, 26 of our total 53 are released from isolation or have met the definition to have completed their isolation course. Again, we have a broad range of ages that have tested positive for COVID-19. It is not a disease that is only in our elderly population. We do see positive cases across the age span. The data on the department website, on the state department website, does provide us a lot of information about the course of the disease in our state. And if people haven't looked at the state website at the dhs.wisconsin.gov site, and they're interested in data, they may want to look there to get a sense of what is happening with disease in the state. There is at that site case data, the number of cases in every county across Wisconsin, and the number of people that have tested not only positive for the disease, but how many deaths and how many total tests have been done. There's also hospitalization data available on that website at a regional level, giving us some sense of the capacity of our hospital system to respond if we did have an urgent increase in the number of cases. Overall, hospitalizations in our region has remained fairly small. With flattening the curve, with keeping the number of cases low in our area, which was the goal with this. The capacity of hospitals has not been strained, but they are certainly paying attention to what's happening around the nation and making sure that they are prepared in case we need to have that capacity available. When we do slow the spread of disease, like we've been doing, we save lives. We make sure that people that need to be hospitalized have available care, and we also make sure that the most current treatments are available for those people. Those things that every day we newly hear about as either experimental treatments or ones that have had enough testing now that they are being utilized more regularly. The state also breaks down a lot of other data points that we don't necessarily have just at a county level, but it does give us a snapshot of things like race and age and ethnicity, as well as information about disease outbreaks, so those places where we have more than one case in a setting. That regional breakdown of outbreak investigations has been available on that state website as well. So, for you to know that we are tracking data carefully. We will have more data at some point on our website beyond what we have now. That is an important piece of information that we think is needed by the community, and we're working on that to make sure that we share local level data that is paralleling the state data, particularly those gating criteria and those capability measures that are in the Badger Bounce Back Plan. As I think most everybody knows, Sunday is Mother's Day. We celebrate moms this Sunday, and we take hopefully a day to go beyond what we should be celebrating every day and really acknowledge how important mothers are in our lives. This Mother's Day is not going to be like any other Mother's Day any of us have experienced. Please remember that the best way to show your mother how much you love her is really to keep from spreading disease. Not only do moms like me want to make sure that our children are healthy and safe, that's the best present that my kids can give to me, but we also want to make sure that we protect especially our elderly mothers from getting exposed to a disease that could be devastating. If you don't live with your mother currently and want to celebrate, please find creative ways to do that virtually, by phone call, by sending a note or letter, or saying that Mother's Day maybe is going to happen later this year when it's safer for us to be together. I'll be celebrating with my 4 children. I love them very much. I wish I could be with them on Mother's Day, but we'll be connecting virtually to do that. And I'll be connecting with my mother, who I am fortunate to have in my life and can connect to virtually as well. I hope others find ways to do that. We also know that many people celebrate Mother's Day with a small gift or a small way to show their mothers that they treasure them. If people are planning to do that, support a local business or support a local charity by a donation. Our community needs that. We need community businesses to be valued and to have that ability to be part of our community. So if people are able to do that, I really encourage you to find ways to talk to a local florist, a local business, or think about a local charity. As everybody, I think, at this point knows, we are having community testing happening in a creative way and in a large way this weekend. So Sunday, May 10th and Monday, May 11th, we will have the National Guard here in Eau Claire at the Prevea clinic site on Claremont, where they already have a drive-through testing site. We will be doing drive-through testing those 2 days, a blitz of testing, hopefully up to 300 tests a day for individuals that do have symptoms. This weekend is a chance for us to get a picture of COVID-19 in our community in a way that we otherwise haven't been able to do. It's important that you think about coming to one of these test sites if you have symptoms. Our goal is to have symptomatic individuals from the area come and get tested. We will have more than 300 tests available each day, so please come and take advantage of that. It is a free testing site. There is no appointment needed. There is no need to have a copay or other charge. You don't need to have a doctor's order to come. That will all be handled on site. If you have symptoms of COVID-19 and are over 5 years old, we really encourage people to come to that drive-up testing site. It is possible also to bike up and walk up for those that are wondering about that. We will make it possible for anybody that needs to be tested to have that available to them. Outside of those 2 community testing dates, we still are working really closely with healthcare providers across the area. They are doing testing. You should call a local provider if you have symptoms and get tested if you are not able to come in the next 2 days or your symptoms start later. The National Guard is in 2 additional locations in our region over the next couple of days. So if you do not have ability to come this weekend on Sunday or Monday, the National Guard will be in Thorpe and Ladysmith on May 13th and May 14th, and that information is available on our website. For those that have questions, please do check our website. Again, that website is available to you, coronavirus.ecehealthdepartment.org. That is a place where you can get information about the testing. If you have questions after that, the call center line is available, 715-831-7425. Again, testing is important. It's one of our primary strategies as we try and contain this disease. But the other thing that everybody needs to continue to remember is that physical distance is our best way to not have the disease spread to us or for us to spread disease. So please remember that strategy is continuing to be very, very important. A final note about our community testing site is that we really are encouraging people that are not well to come and be tested. We are asking that people that just want to see what the site looks like to please stay away and watch it on the media. We are sure that media will be there, and that's a way the rest of us can see the site. We don't want congregation of people that are just wanting to know what's happening, where it'll make it more difficult for us to process people through. So please respect that, and those that need a test, please come and get that. And of those that don't need a test and just want to know more about what's happening, please pay attention on the various media resources that we have. Today, the state announced a whole variety of business opening and reopening materials available on the WEDC website. Wisconsin Economic Development Corporation is the lead for looking at business reopening, and they today shared very comprehensive information for businesses and various work sites to start planning for reopening in a safe and healthy way. The general guidance that they have there is probably nothing new to everybody, but things like making sure employees are protected in a variety of ways, having processes in place so both employees and people visiting the business can stay safe and have hand washing available and have make sure that people stay home when they're sick, all of those kinds of procedures in place. And then really setting up ways to make sure that physical distance is maintained in all of the places that eventually we will be going back to. It will be a new normal for a while, and these guidelines reflect that. Again, all the strategies we can do to prevent a rapid spread of disease as we start congregating back together is critically important. There are industry-specific recommendations on that WEDC website related to restaurants and outdoor gatherings and all kinds of other facilities. So more information there, and we certainly likely will be talking about that in the days ahead. It's important that all of our workplaces are getting good information, so I strongly encourage people to look at the WEDC website, start planning and thinking not only about opening your own business back up, but also for all of us that will be entering those businesses so we know what to look for when we start going out and making sure that we stay safe. Employees need the support that we have as we go out and doing things like keeping physical distance and potentially wearing a cloth face covering in those situations where we may get closer to them. they need to count on us doing the right thing just as much as we count on all of our businesses doing the right thing to protect one another. Finally, there has been a lot of news recently about some of the syndromes that are being newly seen with children and this disease, so that is out in the public as a concern. There have been some recent health alerts across the state with the pediatric inflammatory disease that's been seen by some children. We know that this disease can be very devastating at all ages, and it's a reminder to all of us that none of us is immune from the consequences of this disease. We do need to protect those that are most at risk, the elderly and the populations that have underlying conditions. But we are seeing progressively, as we have more time with this disease, that all age groups can have impact long term, and it's important that we protect one another from the spread of the disease in a way that we can't support individuals with health care. I will end with, again, this is something that we've never seen before. We continue to say that, and we know that saying it's hard doesn't help in the end, but it is hard. It doesn't make it easier knowing that, but we do know it is. Our goal is reaching out to one another, knowing that this is hard for everybody. This weekend, try and find a way that you can reach out in a special way to connect with someone, to acknowledge to them that it's hard, and to reach out. We need those personal connections during this time. We will continue with Monday, Wednesday, Friday updates via this format, and certainly will bring to you any other news that is happening as it unfolds if there is something urgent. And I can certainly answer questions now. Yeah.
So this has been a week when the county has added a lot of cases. Last Friday we had 54 cases, I think. 7 days later we had 53. Do you think the rising number of cases in Craig County is going to continue to pick up speed? And talk about how long you think that might continue.
So the question is really related to an increase of cases that we've seen over the last week and a half or so in a considerable way. It's startling to some people, going from a fairly steady number in the mid-20s up to 54 today. We have had cases really every day recently, and we expect that. What are we expecting moving forward? We expect, as more people are out and about, and as the disease starts spreading in this community, that we will see more positive cases, and we will have to work hard to contain that. It's not a surprise that there are more cases. Many of the cases that we're currently dealing with are connected to one another, so that spread is another example of showing us that it is an easily spread disease, and we are seeing that in this community. So those close contacts of cases are, in many cases in this community and across the U.S., also getting the disease. That's why it's so important for people to stay home if they are a very close contact of someone that is positive. I expect over the next number of months, until we get the vaccine in place and out in a really broad way, that we will continue to see people get COVID-19. That is an expected next step. Our goal is that we spread out the time that we see those positives happening. So the worst case scenario is if we have a lot of positives all at once. That really will be the worst situation for our community and any other community. Our goal, knowing that we will have positives until we get to herd immunity, which is 70% or so of our population, 70,000 people, is to make sure that we spread disease slowly and make sure that we are protecting our most vulnerable populations in whatever way we can. Yeah.
So a member of our newsroom had a question about a rumor that he heard about a construction company that was operating with some workers that had some symptoms, and they refused to shut down due to what the county was saying, and then the county had to forcefully come in and shut them down. So just wondering if you had any details about that at all, or if that's true or not.
Mm-hmm. So the question is related to a rumor in the newsroom about a situation with a construction company and whether there had to be any enforcement action because of that. We work with all of our positive cases to make sure that people that are employed in any situation, that we follow up with employers and work carefully with them. We also make sure that all employees in situations where there is close contact stay home as long as if they are close contact to an actual case. That's part of the work we do with any positive in Eau Claire and across the U.S. A positive case stays home. Any close contacts stay home. If those are employees that work with that individual in an essential service, they stay home, and we work with the business to make that happen. We have had wonderful cooperation in this community with making sure that employees stay home without any issues. Yes.
I think maybe you've been asked this before, but you can repeat it. The county seems to be doing between 40 and 60 tests per day, for COVID-19. Where do you want to see that number before the county reopens? 100 tests, 200 tests per day?
Yeah. So the question was, where do we want to be with the number of tests that we do today, and how does that relate to reopening? So the numbers with the Badger Bounce Back Plan are related to positivity rate and number of positives, as well as a number of other factors for reopening. In Eau Claire and in all counties across the state, our goal right now is testing, so we get a really good sense of disease spread in our community. Actually, since yesterday, we had an increase of 90 tests done, so it was a high number for us. Some of the general information in various articles talk about the number of tests that need to be done to be somewhere between 50 and 100 per 100,000 a day. So we are in that range. We certainly have some way to go to do the number and volume of tests that we would like to do. The bottom line goal for all of our testing is that everybody with symptoms, even minor symptoms, has the opportunity to be tested. And we're still working on that. So right now, our primary push is that not just this weekend when we happen to have National Guard here, but moving forward that anybody with symptoms is able to be tested. And we have a ways to go even in Eau Claire with that, and we're working with providers on that. Certain parts of the state are very far away from that right now. So it's a statewide need, and we'll continue to work on it. Yeah.
I just have one question
Yeah.
for you. How many contact tracers does the county have right now, and how many additional contact tracers is it?
Mm-hmm. So the question is related to contact tracers. There's lots of information about that capacity. What we've done is we've worked with our internal team and people that are within our county system right now to train them. So we have gone from a small group of our communicable disease staff doing the regular contact tracing for all of the other diseases that we have to a core group in the health department that includes a whole variety of staff, but an additional 11 or so people that are able to do contact tracing, and trained a number of additional people to do that when and if we need it. We know next week, if we have a number of positives with our testing event on Sunday and Monday, we will likely have a lot of contact tracing to do. And we've already worked out with the state that if we need that asset in the short term, that the contact tracers at the state level will be assisting as well. We are right now sitting at a decent spot for contact tracing availability, and our team is working on continuing to train and orient those people that will do that job. I've talked before about the fact that this is complicated work. It's not a simple phone call that says, all right, you need to stay home for 14 days. I think we can all imagine getting a phone call like that and how difficult that might be. So it's really someone that can work through with that individual how to assure that if they are a contact of a case, they are able to stay home for those 14 days. Sometimes it's as difficult as finding the people, and once they're found, really working through their special circumstances to make sure that that it's an easier choice to do that. We really need them to stay home, and it's an important piece of stopping the spread of disease.
So you said there's a core group of health department staff, and there's 11 additional people. Is there an
Yeah, I don't have the exact number right now. So the question was, what is the exact number of contact tracers for the county at this point? We can certainly provide that number. I don't have it with me at the moment, but we have trained a number of individuals and they are working through being available for that work. We right now do not have any concerns, even with the 20 additional cases we've gotten in the last number of days. That work is happening easily with the group we have, and we anticipate not having issues moving forward. But we can certainly provide that number at a subsequent press briefing so people have an available awareness of where we're at. All right. Thank you very much, everyone. We appreciate, again, you joining us and learning what is happening related to COVID-19 in our community. We'll be back on Monday. If you have symptoms, please come to one of the 2 dates that we have for that drive-up testing on Sunday or Monday. We do encourage you to consider not coming right at the start of the day so that we don't have a huge number of people. There will be enough tests, so do consider coming at various times throughout the day. And we hope people understand that it's important to at least get a sense of what's going on in our community through that testing process. To those of you that are mothers, have a wonderful Mother's Day. Thank you.